Alright. Oh gosh, should I tell him?
You should.
I tell him about the nonsense of my MRI?
It was yeah, it was big change.
Not a big change.
Big
it's
update.
like not even a big update because we don't even know yet. So
That's true.
I'm gonna go through all of my tests that I just had done, including the blood work and MRI and X-ray, and we will talk about it. Alright, you wanna go watch TV?
I do.
Okay, bye.
And I'm sneaking out.
He's literally crawling on the floor to get out of here. I'm back. Bye. I am back upstairs in our old office, now kind of an extra bedroom. The floor in our actual office, it was too echoey, so until I get a rug, I'm just gonna do my sit-down videos in this room. I think it's the best choice. Anyway, like I said, we're going to go through all of those results now that Zach is downstairs watching TV. I have a whole note on my phone here because I had to write them all out. There was a lot, and hopefully I didn't concern anybody with, kind of my hints at this, but I think my last video, if you didn't see it, it's about how my period has changed in the last couple of months. I think that is a good preface to this video because it kind of tells you all of the symptoms I had that hinted something was up, and I just really didn't catch on to it. And by the way, guys, if you are interested in getting more real-time info from me, I have an Instagram page, LetsTalkIBD, same as on here, so you can follow me on there. I try to share posts and stories and whatnot, just talking about some of this stuff, same as I do on YouTube, but in a little bit quicker format. I don't know, I always prefer the YouTube videos. I like sitting down with my cup of coffee and catching up on everybody's life. So let's talk about the blood work first. I had a quantiferon gold test, which basically is testing for tuberculosis in you. The reason for that is, I know a lot of people are like, why would you have tuberculosis? The only reason they check for it is because you can have latent TB, or basically asymptomatic TB, that if you start a biologic which suppresses your immune system on purpose, it can make it symptomatic TB, which is not good. So that did come back negative, thank goodness. I had a comprehensive metabolic panel, basically looks at your electrolyte, your blood sugar, it looks at some kidney levels and like your kidney function. It also looks at liver levels, which I know a lot of Crohn's disease medications do affect the liver, so they keep a close eye on that. All of those came back great. I talked about the hepatitis B immunity problem that I had, where I don't know why I became not immune to it, so I had to get a booster. I am now immune to it. We are good there. My vitamin D level was fine, folate level was fine, and B12 was fine. I also had a heme profile, which looks at your hemoglobin, your hematocrit, all of that stuff. All of that came back fine. The level that I was the most interested in was the CRP, the C-reactive protein test, which is an indicator for inflammation in the body. I know that there are other tests that can be done. There's like sed rate that can be done. I've had that in the past. There can be fecal calprotectin. That one I've had a couple people ask why I have not had that done. To be honest, I don't know if me not having a colon would affect that number or that test. It might not be as accurate on me. That's not something I'm 100% positive on, but it's just a theory as to why I've never had that done. But I mentioned before when I was getting this blood work done that the CRP would probably come back fine, and it did. It came back as a 2 milligrams per liter, which the frame for you, at least my hospital's frame, is anything under 10 milligrams per deciliter is fine. Back the summer before I had my colectomy and my rectum taken out, which was super inflamed, like they saw it, they knew it was inflamed, my CRP was a 5. So it's never been a great test for me. I don't think I've ever had an abnormal CRP related to Crohn's disease. Now, when I had my kidney issue with the sepsis, my CRP was through the roof. My sed rate was through the roof. That's the only time I've ever seen those numbers kind of scary high. But otherwise, they come back pretty normal. Usually, if I have obvious inflammation going on, it shows up on MRIs or it shows up in scopes. So, let's talk about the MRI that I didn't expect. I didn't expect this at all. We'll just talk about it. I don't want to get ahead of myself because I don't know yet. I have a doctor's appointment. I'm going to go hopefully find out a little bit more about what's going on. So I'll go through all the body parts. I got them all listed here, and I can tell you a little bit about them and what they saw. So my ileum, which is where I previously have had inflammation show up on my MRI, it's right around my stoma, at least it's where it was in the past. Looks great. Actually, my intestines look great. They didn't see any inflammation, which is awesome. Very confusing to me, and the reason is I am having abdominal pain, and that's it's very clear to me, and it's very I've had this kind of pain before, and I can easily recognize it as that's Crohn's pain. That's not related to maybe my kidney or this other pain. Crohn's pain. I know what it feels like. It's burning. It comes on fairly quickly. It lasts for 5 to 10 minutes and then slowly fades away. That's how it always has been on me. And that is what has started increasing more. So I know that there's something going on. 95% certain it's Crohn's. So you might be confused if we're looking at the MRI and they're not seeing inflammation. Why are you starting Humira? In my heart of hearts, I know that something Crohn's-y is going on. Maybe it's not being caught on the MRI. Maybe it's not even that bad of inflammation. Maybe it's food that's triggering this. And, it really isn't that bad, but I know it, this feels like Crohn's to me. This doesn't feel like anything else, and it doesn't feel like what I'm going to tell you they did find. So they did not see any strictures, they didn't see fistulas, and they didn't even see any abscesses, which means that my wound on my bottom, there's nothing hiding up behind it. So hopefully with some diligence and some hard care wound care, I can get this thing taken care of. It closed up again. I don't know. What they also saw was, and this is kind of the first, there's two things that they found that concern me. So the first one that they found, obviously they could see that I had kidney surgery. They saw the pyeloplasty. If you weren't aware, I had pyeloplasty for a UPJ obstruction in the summertime. Basically, I had a narrow ureter on my right side, so they snipped the piece out that was narrow, reconnected, and there you go. So they saw that sucker on there. What they also saw, and I'm going to read this part because I'm no kidney expert here. I just want to make sure I'm saying this correctly, and I'm going to tell you what I think it means. Maybe some of you know what it means. They saw new, which is totally new from the previous MRI I had about 1.5 years ago. They saw new cortical restricted diffusion, delayed wedge-shaped areas of decreased enhancement, which to me, I might be totally wrong, sounds like there is decreased blood flow in portions of my kidney. If the contrast was not able to light it up, maybe it wasn't able to get through with the blood. That's what that means to me. Of course, I could be wrong. I have noticed over the last week, like maybe slightly more kidney pain. What I kind of figure this pain is from, and it's just like twinges. It is nothing like what it was before, because before it was unbearable. And I would spend a lot of time not doing things because I couldn't stand the pain. It was like take oxycodone pain. I just kind of assumed that even though I had surgery to correct this, I might always have at least a little bit of pain with it. I mean, they had to cut me open and like rearrange things in there, so I kind of always thought there would be just a little bit of pain. And the pain that I'm having right now, I'm totally like, it's okay. Like, it's not a big deal to me. It doesn't disrupt life. So you can tell me your thoughts on that one. I'm not sure. And then my bladder looked fine, which is great. For the last thing, I am trying not to get ahead of myself here because it's super easy for patients to do, and especially for somebody who's a nurse and kind of understands what these tests are saying. I mean, patients do too, because we are an active group of patients and we are educated. Sometimes I need to pluck myself out of the medical professional role and let the doctors, you tell me what is happening, and I need to not go on Google. But of course I went on Google for this, and let me know if this is something you've experienced, you have, because I've never heard of anybody having it. I've heard of people having the sister disorder or disease. Quick, brief review of the last video I uploaded. I told you guys that my last period that I had started very weird. I actually thought I was pregnant. Yep. And actually on one of my videos on the live chat, somebody like guessed that, because I mentioned that there was a new thing I would be talking about. Somebody guessed that, and that is not it. My period's very regular. It became irregular. I spotted super early. I bled for 2 weeks. It was really heavy. The pain was not really any different than I normally have. I actually get very severe cramps the first day of my full-blown period, and so I take ibuprofen or something like that. I have to. Like, I know I'm not supposed to take it with Crohn's disease, but I have to. But after that, it's fine. Like, I can usually take one pill, be good for the rest of the day. So the pain hadn't changed. But what they found on my MRI was that I have something called adenomyosis, which is a sister, I don't even know if it's a disease or just I don't know, a syndrome. I've literally never heard of anybody having this. It is a sister to endometriosis. So with endometriosis, uterine tissue can grow outside of the uterus. It can go on the ovaries. It can go kind of anywhere in this area. With adenomyosis, the uterine tissue kind of buries itself, from my understanding from Google. It buries itself into the myometrium of the uterine wall, like, I guess deeper than it's supposed to go. And that is what they saw on my MRI. Editing Maggie here. For anybody who might be in radiology, I thought you might find it interesting to actually see the slides that they had that showed this. Obviously, this looks like nothing to me, but here is where they said they saw the adenomyosis. When you look it up, the symptoms are heavy periods, longer, like drawn out periods, basically all the things that I just noticed last month. I have no idea why this happened, why it started. The other really unusual thing about this is there's two different forms. There's diffuse, so you kind of like see the stuff all over the uterus, and then there's focal. And from my understanding, again, from Google, is that focal adenomyosis is basically unheard of in people who are under 30 and who have never had children. Why I was sad the other day, and again, it's me working things up and overthinking them and just not waiting to talk to a doctor, is that this may affect my ability to have children. I know that endometriosis does that, and I saw a lot of information about that online, but because it's related, there may be issue with that. There may be a problem with miscarriages. So that's why I'm not happy. I guess my kind of theory with this is that the way that this can happen, they're not like 100% positive, I guess, on why this happens, but one of the theories is that this can happen during surgery. And with my kidney surgery, my surgeon removed a lot of scar tissue and adhesions that had formed from all of my previous surgeries. I don't know if maybe he nicked something, but the theory is that, the tissue can travel on a scalpel and be planted somewhere else. What I also learned is that sometimes people with adenomyosis, or like they see it on an MRI, when they go in to surgically remove it, they find out that it is endometriosis based on whatever kind of fluids in it. That was just like one study I read. There are things that they can do. Other than the long period, and maybe that won't even happen this next period, who knows? And the heavy bleeding, of course. I didn't have any increase of pain, so I don't even know if they would bother doing anything. But my understanding is that they can surgically remove the focal area of it. But if it gets to a point where it's bad enough, people do get hysterectomies. So, I've been waiting to tell you guys, and I wanted to understand it at least enough to describe it to you. I do have an appointment. This video is actually going live on Thursday, so I will have just been to the appointment today. And I will share with you what the gynecologist says about this. I'm just kind of confused and concerned. The main concern is fertility. Anyway, please let me know if you have adenomyosis, your experience, if you know somebody with it. I truly don't know anybody. I don't know. Is this a disease? Do I call it a disease? Is it like Crohn's, or is this just something that happened by accident and is a side effect from surgery? I don't even... This is why I'm going to the doctor, and she'll explain it to me, because I just don't know. Anyway, guys, that was my update for you. My goal moving forward is to upload on Sundays, Tuesdays, Thursdays. It just seems to be the easiest schedule for me. So I will probably be talking about this again Sunday evening. I'll probably talk about what happened at the gynecologist's office. Thank you so much for watching this video, and I will see you in the next. Bye!